Jane Doe is a 65-year-old woman that has suffered from a stroke 3 years ago. The presumptive diagnosis is generalized chronic periodontitis. She has infrequent dental treatment since her retirement and has a history of cavities and bruxism. She is a type 2 diabetic with fair control of her blood sugar levels and has high blood pressure. Her medications include warfarin, which is an anticoagulant, metoprolol tartrate, which is for her blood pressure, and dapagliflozin for her diabetes. She presents with sensitivity to hot and cold. Her gums bleed when she brushes, has a bad taste in her mouth, and always has a dry mouth. And she also has dark stains that she wishes to get rid of. She drinks sweet tea daily and tends to sip on it throughout the day. She smoked half a pack of cigarettes for 35 years until she quit after a stroke in 2016. As a result from her stroke, she has facial paralysis on the left side of her face and muscle weakness in her left hand, which is her dominant hand. Along with missing teeth and receding gum lines, she presents to the clinic with multiple carious lesions. This video will explain how to treat Jane Doe based on her symptoms that are due to the effects of her stroke.
So when you're greeting a stroke victim, it's nice to offer them your arm in case they may need your help. You don't want to grab a hold of their arm and just assume that they need help. Also, shorter appointments are recommended, so Jane is scheduled for a 30-minute appointment today. How are you, Jane?
Good, how are you?
Good, we can head on back.
Great.
So Jane's stroke has affected the left side of her body. Her left hand is her dominant hand, so I'm going to show her how to use her non-dominant hand. I'm going to recommend a toothbrush with a larger handle that will be easier to use in her non-dominant hand. You want to hang on to that?
Mm-hmm.
How's that feel?
Good, better.
Very good?
Mm-hmm.
Okay, so when you brush, you want to hold the toothbrush at a 45-degree angle so that the bristles are going down beneath that gum line.
Mm-hmm.
You can see it just like that. Okay? I'm also going to recommend a floss stick instead of traditional floss because it will be easier for her to use in her non-dominant hand. The stick is about the same length as this toothbrush here. So you can just hold on to this, the floss will be at this end. And you just want to go in between the teeth, make sure you're hitting both tooth surfaces between each and every tooth. Patient with facial paralysis may also have trouble using mouthwash because they can't swish it around. So we're going to recommend for Jane to use a water pick and just putting some mouthwash in, mixed in with the water in the water pick and just spraying it in there, just kind of standing over the sink and letting it run out and, you know, directing it in between the teeth and towards the gum line to really get that solution down in there. Suffered a stroke might have facial paralysis. Sometimes that can lead to pouching where the food gets stuck on that side of the mouth after they're eating. So we recommend using the hand that they're able to use, just taking a finger and swiping the food out of there after they're done eating. Also eating softer foods that can help prevent pouching. Since Jane is already at a high caries risk, we're going to recommend that she only drinks sweet tea with her meals instead of all day long because she does love her sweet tea and she usually drinks it all day. So drinking it with your meals will reduce the amount of time that it's in your mouth and just make sure that you brush after to get all of that sugar out of there.
Great.
So when it comes to treating a stroke victim, you're going to want to offer them safety glasses to protect them from aerosols because they might not be able to close their eyelid all the way. So I'm going to put these on you, Jane. You also want to lay them back in a semi-supine position because sometimes they have difficulty swallowing. And if they're laid all the way back, that could make it more difficult for them to swallow, so you want to keep them in a semi-supine position. Also, their medications can cause urostomia, so you want to keep in mind to rinse more frequently.